Wrist fractures in the Vail Valley are very common. We commonly have wrist injuries from all kinds of mechanisms that are both snow sports as well as summertime sports, between falling off of structures or mountain bike crashes in the summer versus, of course, skiing and snowboarding in the winter. Snowboarding is far more common, and then we also have a lot of patients that slip on the ice. And so all these mechanisms are very common. The symptoms of a wrist fracture are usually quite clear. There's obviously a lot of pain, and there's fairly immediate swelling. There's a lot of bruising, and often can be some deformity in the wrist. The fact that there's not really much covering of muscle on the wrist, you can see basically skin and bones, and so most patients it's quite obvious that they have a substantial injury because of the deformity that they see. If the alignment of the bones looks fine, then non-surgical treatment is the way to go. In general, with a broken bone, if you hold it still with a splint and a cast, then it heals very predictably, and this is no exception. And so in general, once the x-rays are done, then we know the alignment of the bones. And if there's a badly broken wrist, but it still is in good overall alignment, then typically we'll do a splint for 1 week to allow for swelling. And once the swelling has come down, then we place you into a cast. That's the first line of treatment, is always non-operative treatment. In patients that the bone has gone out of position and it has angulated, then it needs to be addressed, because it will heal in the wrong position and then you'll have very poor function. And so if it needs to be surgically fixed, then that means it usually needs to be realigned. And this is an example here of a bone, the distal radius, which is right here at the wrist bone. And this is kind of the most common typical pattern, where the fracture has broken here at the distal radius and it is shortened down, so the hand and the wrist has come off the forearm. On the side view here, same idea. The hand and the wrist has broken and fallen back, and that's very typical from the mechanism that it breaks it and it falls back. Similarly right here, so the fracture lines come through here, comes through here. There's a separate fracture on the small bone, and it's very shortened and out of position. So this patient will 100% require surgery to have a good wrist, but the good news is that the end result will be really good. So as a second line of treatment, or even third line of treatment, is to fix the bone. And the way that we tend to fix these is with a purpose-built small titanium plate. It's got small locked screws, and essentially we line the bone up, and it usually will line up just perfectly for us. And then we'll put a small plate on there with some small screws. And if that's the case, then you do not need a cast, and you can go into a removable splint as soon as a week out from surgery and begin gently working on your range of motion. And so patients, even though they had to have surgery, they do surprisingly well, because they're able to get their function back and get their life back with their arm. As far as expectations and recovery time with a patient with a wrist fracture, they're both good, meaning that the recovery time for any broken bone is approximately 6 to 8 weeks. But again, it's a very predictable healer, and I tell that to every patient, that it is a predictable healer. And so they can have high expectations to have reasonably good function of their wrist, but it takes time and it takes a bit of patience. We have to kind of do things in order, meaning we need the skeleton or the bone to heal, and then we can work on getting the range of motion back to where it was basically before the injury. And then last is strengthening. So in that order is the recovery time for full recovery. I usually tell patients around 2 to 3 months until they feel like they have a good, competent wrist, but there's still a little bit of strengthening that often needs to happen.